IV therapy can help with nausea by providing rapid rehydration and delivering essential nutrients directly into the bloodstream. Nausea can be caused by a variety of factors, including dehydration, nutrient deficiencies, and gastrointestinal disturbances. IV therapy can address these issues by delivering fluids and electrolytes directly into the bloodstream, which can help alleviate dehydration and restore normal fluid balance in the body. In addition, IV therapy can deliver essential vitamins and minerals, such as vitamin B6 and magnesium, which have been shown to help alleviate nausea and vomiting. IV therapy for nausea is typically administered in a clinical setting by a trained medical professional. The treatment is well tolerated and can provide quick and effective relief for nausea and vomiting. Overall, IV therapy can be a safe and effective treatment option for individuals experiencing nausea, especially in cases where oral intake is not possible or has been ineffective. However, it is important to consult with a healthcare provider before undergoing IV therapy for nausea, as underlying medical conditions may need to be ruled out or addressed first.